So, what are we looking at? Anna, what am I looking at?
So we have two patients here. The first patient is an treated hepatocarcinoma. The second one is a liver metastasis resection.
Okay, so let's look at case one. Tell me how you tackled this.
So first of all, you have to make sure that you are seeing a real thing. So for that reason, you go to the conventional, you see it's real, it's very subtle. You go to your maps, your spectrum maps, and in the first image, you have the mono E 40 kV, which is going to improve your detection of iodine, right? Because of the photoelectric effect.
Because I can see on that first image, the conventional, it's perceptible, but barely perceptible.
Exactly.
It really boosts the iodine in that low.
It's barely seen, and then you can see very well, right? So you're not gonna miss out.
Yeah.
And the second one is kind of a reverse image of the first, is an iodine removal. So it's black instead of white, and it's not hyperdense, it's like black, right?
So you're confirming the iodine has been subtracted out, it's iodine.
Exactly. In the Z effective map is based on atomic number. So it's a color map, is kind of visual, and it's also to reconfirm that you are seeing the same thing and it's real. And lastly is a overlay iodine maps. Again, is qualitative assessment to pick it up quickly.
Okay, and then you do a quantitative analysis to confirm, I suppose.
Exactly. So now you want to place an ROI where the problem is, and then this is telling you the concentration of iodine in milligrams milliliter. In this case, we have 3.1, which is basically a lot. So this is viable tumor.
And that obviously meant that this is not a bleed, it's tumor, and that of course changes the management.
Indeed.
So tell me a bit about this case now.
So this case, the image is similar because it's an heterogeneous liver lesion, right? And we have a hyperdense area, but we don't know, is this blood, is this tumor? And so in the conventional image, it's hyperdense. And now we have another map, which is called virtual non-contrast map.
The second image here.
Exactly. This map is going to virtually remove, as the name says, right? The contrast.
And I can see that in fact in the aorta, I see a lower density, it's subtracted out the iodine.
Exactly, and now we're seeing this is hyperdense again in the virtual non-contrast, which is...
So it's not contrast.
Exactly, which is blood. And now we can confirm this with, as you can see in the third image, in the density map, is 0.4 milligrams milliliter, which is not real significant uptake. So we are 100% sure there is no viable tumor here, and it's all post-surgical treatment.
So
changes.
It saved them maybe from a biopsy.
Exactly. Or an MR, for example.
An MR.
Yeah, so you kind of avoid further investigation and interventional procedures.
What excites you most about spectral CT?
That you can change the management of the patient, because this is like a problem resolving tool, and you just right away make a diagnosis and you avoid further investigation, as I said before. So I make an impact in the patient.